Hi everyone, my name is Rachel and welcome back to Conversations with Dental Friends. Today's episode is a little bit different, it's a bonus one, and honestly I'm just so excited about it. It was inspired by episode 8 this season with Aoife and Lucy. If you haven't listened to that and you're thinking about applying for dentistry, go back and have a listen. So many top tips there. And as you probably know, I'm a dental therapist, and since we're right in the middle of application season, I thought, why not pull together the ultimate guide for anyone who's applying right here, right now. So I've stitched together some brilliant advice from Rosie Murphy and Aaron Stewart, both from season 1, who went through the application process last year, this year, and both got into dental therapy, which, can we just pause and say, a huge achievement and congratulations to them both. If you're on that same journey, hopefully this episode will give you practical tips that you can use just straight away, or something that you can pass along to a friend who's applying. A quick favour, before we dive in, if you've been enjoying this season so far, it would mean the world to me if you could just tap follow. It just literally takes 2 seconds, but it helps me bring you more bonus episodes like this one maybe. It helps the podcast reach people who need it, and it means you'll never miss an episode. All right, let's get into it. Your guide to applying for dental hygiene and dental therapy with Aaron and Rosie. This podcast is sponsored by Dura Dental, a company that's been setting the standard in dental innovation for over 80 years. Whether it's their ultra-reliable suction systems, world-class hygiene solutions, or cutting-edge dental imaging technology, Dura Dental supports dental professionals who take their craft seriously. Check them out at duradental.com because excellence starts with the tools you trust. And of course, a huge congratulations to Oratol celebrating 60 incredible years this year. Happy birthday, Oratol. Here's to many more years of innovation and excellence. I truly couldn't imagine the dental industry without you. So happy birthday from Conversations with Dental Friends. So Rosie, you've always had a passion for dental hygiene and dental therapy as long as I've known you, and now you've officially accepted an offer to study oral health sciences at Glasgow University. Yeah.
I know.
Huge congratulations.
Thanks so much.
Absolutely amazing. I'm so proud of you, Rosie. How does that feel?
Good question.
Yeah.
I'm still in shock. I feel like
Fairly fresh, isn't it?
yeah, I was being like last week, who knows? But I think working towards this for the guts of 6 years,
big goal.
and majority of that time I'm thinking it was so out of reach.
Yeah.
I actually seen screenshots on my phone from 2019 looking up dental therapy,
And what it actually was.
and I was like looking back at that the other day, I was like, whoa, to finally get there, it's people, you think you'd expect me to be completely like over the moon, which I am, but I'm processing it, you know.
It's a mix of emotions too, because obviously there's change involved.
Yeah.
No.
Holistic change.
But it's adapting to that this new chapter for you.
Yeah.
But it's very, very exciting.
It's so exciting.
Very exciting.
I'm buzzing. I think it's going to be hard leaving my family.
For sure.
You know, not all of them, but it's going to be hard, I think, and it's going to be hard for them too.
Yeah.
My parents are obsessed with me, as they should be. So I think me moving across is going to be a big change for everyone. I personally can't wait. I can't wait to be in my own space.
Yeah.
And not hear anyone playing music in my house.
Yeah.
My sister.
Yeah.
And just relax. Well, I won't be relaxing because we'll be studying, but I have this perfect idea of what my life is going to be like.
Yeah. Your vision board?
A vision board, yeah. Just be studying, boxing.
Yeah.
Just enjoying. And my brother lives over in Glasgow, so
So you have that kind of
and you know, I have friends over there too, so I'm not worried at all about the moving part or the new environment, because I think that where Glasgow's very similar to Belfast.
Very similar. And I think it's been great for you because you have had such an insight. You know, we've worked together. You've worked with other dental hygienists, dental therapists. You've worked with cosmetic dentists that are doing really nice restorative work. You already have such a good idea of what the role's going to entail.
Yeah.
That's been the best preparation you probably could have got
100%. I feel like I'm so prepared.
Yeah.
More so than someone coming out of A levels.
Yeah.
And I don't know how someone could cope or manage going in dental therapy doing A levels, but they do it. I always sit there in surgery and be like, just maybe you go for a cup of tea.
Yes.
I'm so confident. Realistically, they'll put it in my hand and it'll feel so foreign. I'll be like, what am I doing?
Yes.
But
and the reflective nature and everything, you know, there are those little things about it that take a bit of time, but then after a certain amount of time you don't even think about that.
Yeah.
You know, and you're artistic as well, as you mentioned, so that stands you in really good stead, because I know dental therapy, in particular restorations, is something that you're most interested in.
Yeah, 100%. I think that's why I don't want to just do I didn't want to really just do hygiene.
Mm-hmm.
I applied for hygiene and courses and as you got rejected them.
And you can, if you are doing dental hygiene, you can of course top up. And I know University of Essex offers that, but to do something that you have that passionate about from the outset, and I know Glasgow was so much to you.
It was just the perfect outcome, and then it ended up being that. But yeah, restorative. I think anytime I'm doing fill-ins with a dentist, I'm near enough in the patient's mouth, seeing how they mold it. And I think that's what because I'm artistic, I'll enjoy it, you know.
And you love it, and you never get too old when you do it.
Yeah.
And you've done some jewellery making as well.
Yes.
So you've tried your hand at a lot of different things. There will be transferable skills.
Yeah, definitely.
I'm sure for you, Rosie. For anyone thinking about following the same path, what does the application process look like as someone who's just been through it? And what advice would you give to others looking to train as a dental hygienist or dental therapist?
The application process, first of all, you have to do your personal statement, which obviously is my weak point because I can't.
You did a very good personal statement, Rosie. I looked through Rosie's personal statement sitting in an airport in Greece, and
well, it's lovely. That personal statement had been seen by many of eyes, so I could get it perfect, you know, and. So I was actually really happy with that, you know. I feel like good job. I couldn't have done it better, or we all.
It was quite collaborative.
So I was happy with that, and then you go on to the next stage, which is waiting to hear back for interviews, and that takes months. You're sitting around,
and they come in dribs and drabs.
Yeah, like you know, I had an interview before Christmas, and then I had my other interview. It's been a couple of weeks ago, basically. You do lose I felt like I lost the motivation. I remember I actually got rejected to Teesside the day I got an interview from, or I was given an interview invitation from Glasgow, and I remember that day
a roller coaster.
Do you know what? I didn't even think about the interview request. I was just so caught up on failure. So I just let myself feel it that day and feel like a loser, and just being like, right, I'm going to pick myself up tomorrow because I'm not letting this affect my next interview.
Yeah.
Which I didn't clearly, but I did the next interview in person, and I would recommend to anyone, if you're doing it, just go in person.
Yeah.
Obviously, you're planning for 5 unis, you're not going to want to go
hard exponentially as well. You know, I remember whenever I was doing my interviews, they were all in person, and I think Zoom was a thing, whatever. Although it probably like Skype or something. I think that there are people that come across very well on Zoom, of course, but an in-person interview, you're reading so much about the person in that situation. It's not just a dialogue. So I would agree with you. If you can do an interview in person, go for it.
Because I remember going to it and I just felt way more confident. I ended up turning up an hour early and someone didn't show up, which I thought was mad. I couldn't wrap my head around how someone wouldn't show up.
I know, because it's your dream, and you say, why would somebody just spread this?
Exactly. I was like, this is an honour to be here. What are you talking about?
Yeah.
And then I was brought in, and I think the two ladies that interviewed me, I got along with before the interview even started.
Yes.
And I also had it in my head.
I would have liked that you were early.
Yeah.
Probably. And I liked you, of course.
I had it in my head that there was going to be 6 people in a straight line in front of me just to scare myself. And in the moment I went in, I was like, right, it's not 6 people, it's 2 people, and we're sitting at a table together.
So already it was slightly more informal.
Yeah, so I kind of like bigged it up to know that it would ultimately be so much easier than what I think. And I had a laugh with them. I was fully myself.
You said to me you were a professional yapper whenever you get into it.
Yes, I honestly wouldn't shut up, and I feel like sometimes you could speak too much. So when I was practicing the whole weekend. I remember people I was practicing with, like, you can stop there. You don't need to keep going. And you just, it can be short and sweet. It doesn't have to be like blabbering on, which I did find myself doing, but it got me where it needed to get. So
it did.
There you go.
It did. And so you do your, is it through your application with, was that through UCAS, or do you apply independently?
You have to do it for UCAS, and you have to fill out all this stuff. You put your results in. And it's just annoying. Yeah, so many people don't do it because there's just so much effort.
Yeah.
And you have to pay a fee of like £25. So it's
okay.
Like that.
I didn't know that.
Yeah, it's just annoying things. You get your references. You were my reference.
Yes.
Shout out Rachel.
For sure.
You do your interview, and they said in my interview you'll hear back at the end of the month. So probably around no time. And I heard 2 weeks after, a week after, and
because they loved you. Yeah, of course they do.
So yeah, that was I just love to know why they chose me, you know, just in moments like, what was it the thing. And I remember sitting for the interview, and right in the middle of the interview I said to myself, in my head I was like, I got this, I've already got this. And
you need to have that self-belief when you go into it.
And I feel like mine fluctuates, but in that moment, in that room, at that time, I was like, I had guessed, why you? And I was like, oh, good question.
Yeah.
And I goes, I don't think I'm better than anyone else. I don't think I deserve it more than people out there, but I know for a fact I want this more than them.
Yes.
It was a simple answer. Like,
I think I felt like that whenever I went to do my interview for where I eventually went to university at Newcastle Dental Hospital. I think I felt exactly the same, and I actually got waitlisted, but whenever I was just about to go into the interview, I still remember being in the bathroom, what I was wearing, and I just had a moment of being like, you've got this is where you're going to go. And it's nearly that little extension of that into the universe.
Yeah, because manifesting, your manifesting is like, it is a real thing. You know, I did a vision board there at Christmas, and I wrote on it, like, it's a whole, everything on it. It's halfway through the year and I've got it all.
Yeah.
You know, it's like, I'm such a strong believer in it. If you like put it out there. And when I rang my mum and told her I got in, she goes, everyone wanted this for you. And it was so many, like, it was like a collective mad congregation. We all really, like a cult really of people.
We all really manifesting for me. We'll all be making our vision boards tonight.
Definitely.
So what advice would you give, apart from a vision board, for somebody who wants to be a dental hygienist or dental therapist?
I think dig deep. Are you doing it for the wrong reasons?
Yeah.
Are you doing it for financial gain? Are you doing it for like a status?
Yeah.
Or are you doing it because there's a passion there? And I think,
and you want to help people.
I think I am right now, regardless of my setbacks, is because there's a passion there. It has to be. So I think passion above everything. And I think that's what they seen in that interview that day, is I had passion.
Yeah.
I wasn't just another person, just decided within the year that I want to do this. Like, this is a long time coming. And also within your interview, just be yourself. And like, you hear that all the time, but just be yourself. And what the advice you give me, and many people have given me, is don't give up.
Yeah.
Just keep persistence. And that's the word you said. Persistence is key.
It will be one of the times, it will be your time.
Yeah, 100%. Like, it has to be.
You just have to keep getting up like a boxer, like you are.
Yes.
You just have to keep getting up and going for it again.
100%.
Absolutely. So you're moving on to this exciting new chapter, Rosie, and you're making waves. This episode is sponsored by Lighthouse Dental Company, your partner in creating beautiful, functional dental practices. From equipment supply and servicing to full refurbishments, including flooring, cabinetry, electronics and plumbing, they manage the entire project so that dentists can focus on what matters first, their patients. You can explore how they bring practices to life at lighthousedentalcompany.com. So, Aaron, what is next for you? What's the next big goal you're working towards?
So for me, the next goal is to first and foremost make sure that all of these postgraduates are done and dusted, completely passed, and
your
not looming.
Is complete.
Yeah, which I think is very soon. I think I've done most of the ones that would interest me. I'm not just doing them to do them. It is something that I want to do to help fulfill that passion that I have for them. And I think to do the rest of them would just be a waste because it's not my passion to do those ones really at this point in my career. In terms of this mid-term goal, the next step for me would hopefully be progressing on at some point to university to do a degree in dental hygiene or dental therapy.
Love this. I love this.
It's something that obviously I've been soft launching and slowly working towards with doing the postgraduate diploma. And I'll be looking into other aspects of meeting further prerequisites for that in September time. Maybe looking into an access course, steering my education more away from the dentistry side of it and meeting more of the general prerequisites to increase my chances. But at the moment, it is just mainly focusing on the dental nurse aspect and getting all those postgraduate diplomas done and dusted and wrapped up. And so I can start working on other aspects.
And you've started the application process as well.
Yes.
For dental hygiene and dental therapy. Can you tell us a little bit about what that application process looks like?
It's very stressful. First and foremost, it's a lot of applying, waiting, getting an interview or getting knocked back for interviews, which is obviously, it is quite disheartening, but nothing that you're meant to do will pass you. You will eventually get it. And I think that's sort of the attitude that you have to remember. And if it's something that you really want to do, you will keep going for it. I don't know a lot of people that's got on their first time. Like
I certainly didn't.
Yeah. I have a friend that she's recently got in and she'll be on maybe in the future. But she's been a dental nurse for 6 years and applied 3 times. And only get in this time. So she's been actively applying for 3 years and wanting to do it probably for a good 5 out of those 6 years. And it's really good to see stuff like that. But it helps you remember that it is something that will come eventually if you're really interested in it and you put in the hard work to meet those requirements, because it is such a competitive, field. For a lot of people, a lot of dental nurses, they see it as their natural next progression. It's not even a question. So you're competing with so many dental nurses that are really passionate about it. And it's important to remember that you're not the only one with passion. And other people deserve their shot as well. And if they've done what they need to do, they deserve it as much as you. So it's that major aspect. But the applying, then hearing back, and then you get your interview, and then you have to do a lot of waiting depending on when you did your interview. I applied quite late this year. I applied a few days before the deadline.
I think you were poked by a lot of people, including me.
Yeah. Rachel was very kind to write my reference for me this year, so it was really kind of her to do that. But I was very much in the mental space of I had just left another job that I had went to, and I was coming back to Ormo Dental Care, working in Pace Dental as well as a part-time dental nurse there, working with their implantologist and sometimes with their hygienist. But then chatting to both of the teams, and they agreed that I should absolutely go for it.
They want the best for you as well. I think as a community of people in dentistry, we all want to see each other do well, and we want people to achieve their full potential. So did you apply through UCAS then?
Yes, so I applied for UCAS, which is always an absolute nightmare.
It is.
And I applied last year as well. I didn't have really any of the prerequisites that I had now. I was only really applying off of the guys of being a dental nurse and some like old.
Which sometimes is enough.
That does give, I think, a lot of people hope. If you want to be a dental hygienist and you have that passion, but you can't go back and do an access course, or you can't go back and do your A-levels, sometimes that is enough. But it is so competitive it is hard just to get in off that.
So what aspects did you have to fill in on your application? Obviously your details, and then you did a personal statement.
And I had to then add in qualifications that I got when I was 14, 15 for my GCSEs, and had to scarper through all the old certificates that I never thought I was going to look at again.
Yes.
And then older A-level ones that I'd done. And then I went back in the second year of A-levels and decided that I wanted to do at least a science-based one, because I knew that healthcare was something that was looking to go down. So I ended up doing art as an A-level. I ended up doing music as an A-level. I did health and social care, to be fair, which was probably a smart choice. But then I went and did like a general science A-level, so it wasn't a specific one, but it incorporated all 3. I had to put all those
onto your form. And then the nervous wait. But you did get a couple of interviews. Can you tell us a little bit about the interview process?
Yeah, absolutely. So For me personally, I had 2 interviews out of the 5 choices that I'd applied for, and I then had 2 of the interviews initially. Actually ended up getting a 3rd interview as well, just due to a mix up with the application. But the 2 main ones that I had, I have done them quite recently in terms of wait time, because a lot of people wait months for them. One of the interviews was more traditional, what you would expect from an interview process. It was a lot of questions about resilience and patient care and why I would be a good dental hygienist and why I was interested, just the ones that you would sort of imagine. The other one, the way the interview was set up, it was definitely not traditional. I actually had to submit a presentation and then I had to go to a shorter interview. It wasn't as traditional. It was just more asking about me as a person, more getting to know you, why you wanted to do it. And then I also had to do group work with other applicants,
Amazing.
which I thought was quite good. Both of the interviews were completely different, but I liked both of the vibes. I was sort of ready for both scenarios.
I'm sure you've learned so much about the process by doing those interviews. Only good things can ever come from throwing your hat in the ring and giving everything a try. And I just wish you the best of luck with your outcomes, and I know that you will be an absolutely fantastic dental therapist or dental hygienist, whichever pathway you decide to go down. A brilliant addition to our profession, and thank you so much for taking the time to chat to me today on Conversations with Dental Friends.
Thank you, really appreciate it.
This episode just reminds me how much I loved chatting with these guys in season 1. It's been such a joy listening back to Aaron and Rosie's episodes, hearing their advice and watching them take those first big steps into dental therapy. I've actually got a couple of little special messages from Aaron and Rosie just to give you a sneak peek of how they're getting on as they start their new course in dental therapy, and to give you a little taster of what things could be like for you if you decide to apply for dental therapy or dental hygiene or oral health sciences this year.
Hello, my name's Aaron. I appeared on season 1, episode 11 of A Conversation with Dental Friends with Rachel. Since appearing on the podcast, I have went on to start my oral health sciences degree at the University of Highlands and Islands to hopefully train to become a dental hygiene therapist. It has been an absolute joy to be in the university. It's what I've worked towards for the past 3 to 4 years, and it all feels like it's finally coming full circle. I'm absolutely loving the course content, the people I've met, the tutors, the university, the location. It's all perfect, and I'm really excited to start treating patients in October. Definitely, I would say to anyone, especially anyone considering a career as a dental hygienist or therapist, to just go for it. It doesn't matter what stage in your career you're at or what stage in life you're at. It's definitely so rewarding. I'm only a month in so far, and I'm already so excited to see what the next 3 years and, obviously the future as hopefully a qualified dental hygiene therapist in the future brings for me.
Hello, my name is Rosie. I'm currently studying at Glasgow Caledonian University Oral Health Science. I've been here for maybe 3 weeks now. I kind of lose track after the first week. I'm already starting on phantom heads, and that's been amazing. It's funny because you think that you can do it as well as the dentist. You look at them and be like, oh, just move over, let me do it. It certainly isn't like that. It is probably the most humbling experience ever, but it has been amazing. Hopefully at Christmas time we'll start on patients, which is exciting. Yeah, I've been loving it. Every experience I've had with it, and the studying has been mental, but like I'm studying something I love, so I'm so grateful for that. I think anyone who's thinking about it or wants to get started in dental therapy or even any dentistry at all should do it. Don't look back. It's hard. You can't say it isn't easy, sorry, moving to another city, because it is, you miss people, a lot of people, but you just have to get on with it, and it's a lot of excitement. But yeah, just go for it if you're thinking about it.
If you're at the stage of applying, Definitely have a look at the different universities that offer dental therapy and dental hygiene. And remember, you don't have to be a registered dental nurse to apply. I went through straight with A levels, so don't let not having a nursing diploma hold you back. That said, if you feel the dental nursing route would strengthen your application, you can check out the NEBDN to explore that pathway. For those already working as dental nurses, there are also some great post-qualification courses you can look into to boost your experience and your personal statement, of course, like oral health education, sedation nursing, fluoride application, impression taking and scanning, radiography, implant nursing. The list goes on. There's so many of them. And if you're simply keen to expand your knowledge more generally, there are access courses available that can also open doors for you. Something that I do just want to mention is that there is a new test coming into certain universities, whether you're applying, which is a Casper test. So what is a Casper test? Well, I've done a little bit of research into it. So Casper is an online situational judgment test, and it's used by some universities as part of their admissions process. Instead of testing science knowledge, it looks at your personal and professional attributes. So it's a little bit more like a job interview, those kinds of questions, things like empathy, communication, teamwork, ethical decision making and resilience. Universities want more than just good grades and good test scores, and we as a group who have been applying to dental therapy and dental hygiene over the years are all extremely high achievers. It's hard to separate the candidates. And in careers like dental hygiene and dental therapy, you'll be working directly with patients, and the situations are often going to be sensitive. So Casper helps admissions teams see how applicants might respond to real world scenarios, so they can select students who aren't just academically strong but also have the right values and those right interpersonal skills as well. So what does this test actually look like? Now, I haven't taken one of these because I qualified a long time ago, but from what I found out, it's an online test. You take it at home. It lasts between 90 and 100 minutes. You can take breaks whenever you're taking the test. You'll be shown a series of video or written scenarios, for example, workplace dilemma or maybe an ethical issue. And after each scenario, you'll answer a few open-ended questions about what you do and why you do it. Responses are typed, so you need to be there ready to type short written answers. They can be spoken answers as well, and you record on a video depending on your format. Most importantly, there's no right or wrong answer, so you can't really cram or study for this. It's just about how you think, justify your choices, and show that professional judgment as well, which is super important. So how can you prepare for it? I know some of you guys out there are trying to do anything and everything to prepare for every aspect of this application and interview process, but you can do practice tests on that official Casper website, which I will link in the show notes, so you're not surprised by the timing or the structure. Now, obviously the test you complete will bear no relevance to your actual test on the day, but it gives you a little bit of a feel for it, so you're not going into everything completely green. You can do a little bit of self-reflection, so you can reflect on your own values and think about situations at work, or if you've been volunteering, or even in your daily life, your hobbies, different things that you might do for your family where you've had to resolve a conflict, show empathy, make a tough decision. And then you can use some frameworks whenever you're answering. You can consider multiple perspectives, the patient, the colleague, the wider team. Sometimes that's good to show that 360 knowledge and show fairness, professionalism and compassion. You only have a couple of minutes per question, so it is a really good idea to do the practice tests. So you can practice writing or speaking really nice and concisely and kind of have a few answers loosely held together for yourself so that you're not wasting time thinking on the spot. But don't cram knowledge. It's not about dental facts. Nobody's going to ask you what forceps you need. Nobody's going to say to you, how would you approach charting or anything like that. It's just about how you think and you behave. So don't worry if you don't have a dental background, you can still answer these questions really effectively. If you've got any more questions about Casper, you should really pop onto their website and they'll be able to give you lots and lots of information there. You can speak to the university directly as well if any of your universities are letting you know that they want to use Casper. The 3 that I've found so far at the time I was recording this are University of Manchester, University of Leeds and King's College London. You can keep up with Aaron and Rosie on Instagram. Rosie is at r.j.dentaltherapy and you can follow along with Aaron at Aaron Dental Therapy, where they are sharing their journeys through first year and beyond. They're both really approachable, really lovely, so don't hesitate to drop them a message if you want advice or just a bit of an insight into student life. For all things Conversations with Dental Friends, you can follow along on Instagram at Conversations with Dental Friends and you'll find me there too at Homegirl Hygienist. I'm on TikTok as well. I'd love to hear from you if you're applying for dental hygiene or dental therapy. Let me know how it's going and what stage you're at. And finally, a little heads up, season 3 is going to be with you next week. I can't wait to share it with you, so I'll see you next Thursday.